All right, we've talked a little bit about writing educational gaps, but I just want to delve in a little deeper just to make sure we get a good sense of that because it's really the meat and potatoes of the needs assessment in terms of trying to provide the compelling reason to create an educational program. So you want to describe the difference between what clinicians know and do now and what they should know and do to improve patient care. Sometimes it's a little difficult, right? So, one of the educational gaps in the NF needs assessment that I talked about was understanding the pathophysiology of NF1. Now, that's a little complex. It doesn't really translate to patient care, but it kind of does because clinicians need to understand why they're using an MEK inhibitor. And so, if they don't understand that there's a problem with the cell signaling in NF1, then they're not going to understand the benefits of using an MEK inhibitor. So you have to sort of try to think through why an educational gap will result in a change in patient care. And in this case, we want to sort of not promote, but build awareness about the use of MEK inhibitors, which could help their patients and improve outcomes. And then each educational gap should be specific, clearly state the knowledge or practice deficiency. Especially helpful is if you have a key opinion leader making a statement to that effect somehow that you can quote. It should be clinically relevant and it should be backed by evidence, data, or clinical observations. What's really helpful also are surveys of clinicians, like that shows that they what their opinions are about things or their practices. Very hard to find, but not impossible, especially with Google and the search tools available today. You can really find some things like survey on clinical practices with regard to multiple myeloma or whatever. So you can search Google up and down for all of these things. We've already covered much of this, but one thing I want to mention about the importance of this is you want to provide enough data and scientific write up to show that you know what you're talking about, but you don't want to do what's called a data dump. So describe every single clinical study and all the response rates and p values. I mean, it's like you want it to be engaging to read, even though rumor has it that sometimes these aren't really read by the pharmaceutical company, but sometimes they are. And anything that makes something longer than 3,500 words, if that's not the format, then you want to avoid that. So avoid a data dump. Additional tips: use data or literature to justify each gap, obviously. Link gaps directly to learning objectives, which you'll do in that table. And then here are some of the things that you can consider to highlight with gaps: new guidelines or treatment approvals, known practice patterns or barriers, misdiagnoses or delays in care, prioritize practice changing gaps over general awareness issues. So you just don't want to have knowledge for the sake of knowledge. That's not what we're looking for.